Hi everyone, my name is Jason. I'm going to be demonstrating the use of this iontophoresis machine for therapeutic rehabilitation. Now the basic purpose of iontophoresis is to deliver medications transdermally or through the skin, especially if someone can't tolerate oral medications or medications via injection. So medications are electrically charged, and depending on whether they're positive or negative, they can be repelled or essentially pushed through the skin via these electrodes here. Now, although many substances are delivered via iontophoresis, the two most common substances we see are dexamethasone and lidocaine. Dexamethasone is basically a corticosteroid with anti-inflammatory effects that treats conditions like bursitis or tendinitis, while lidocaine is a local anesthetic used before surgery. Now, dexamethasone carries a negative charge. So if we were to deliver it via iontophoresis, we would use this black electrode here. If we wanted to deliver lidocaine, we would utilize the red electrode here. But before we even apply any medication, we have to figure out how strong of an electrical current we need to facilitate the delivery. And we also have to figure out how long that delivery lasts. So let's take a look.
Hello, my name is Stavros, and I'll be showing you more in depth with how to use the iontophoresis machine. Okay, so right here we have two knobs. One knob shows the on, the dose, and the start. The other one is for the current. Now let's look more into depth with this knob. This knob will dictate the treatment time. Common sense tells us that a higher current, which is measured in milliamps, means shorter treatment time, which is measured in minutes. This minimizes the risk of burns to the patient. The more we turn the knob to the right here, the shorter the treatment time will become in the middle of the screen here. The product of our milliamps and minutes or milliamp minutes is specifically how iontophoresis is measured. Studies show using a dosage level of 40 milliamps minutes with a maximum current of 4 milliamps, which would be adjusted with this one, is effective during delivery while minimizing the risk of burns, as we mentioned before. This machine gives us the flexibility to lower the milliamps to 3, 2, or 1 to accommodate patients' comfort. However, keep in mind that as you lower the milliamps, the treatment time will increase. For example, using 4 milliamp current, which would be this one, will mean a treatment time of 10 minutes. To achieve 40 milliamp minutes, which would be 10 minutes, but if we use 2 milliamp current, our treatment time will increase to 20 minutes to achieve 40 milliamps minutes.
Ultimately, we as clinicians want to deliver all of the medication prescribed in the shortest amount of the time possible, as long as the 40 milliamp minute dosage level is achieved. However, we must keep in mind how much current the patient can tolerate, which might increase the treatment time. Therefore, it's recommended to start delivering the drug at the maximum 4 milliamp and lower the current during the treatment as we gauge the patient's comfort level.
So right now we're gonna deliver the medication on patient's forearm. So first things, let's us to wrap the patient's forearm. So make sure there's no any lotion or the oil stuff on the forearm. And this is the medication pad. So we deliver 2.5 cc's mat in here. So we equally spread the mat into the pad, and then we place on the patient's forearm, and the dispersive pad gonna be the patient's the bicep. Make sure the pads fully cover the patient's arm. Alright, so in this machine, as all we know that the polarities matter. So today we're gonna deliver the lidocaine, which is the lidocaine's charge is passive. So the passive charge on the mat, on the treatment pad, and then the negative charge on the dispersive pad. So here's a little pill. Alright, so let's turn on the machine. So start with 40 milliamp per minute. Not too much. Alright. So alright. So current gonna be 4. If it's a 4 current, and then gonna be take 10 minutes. If patient skin sensitive skin, and then we can change to 3 current, and then the time gonna be 13.5. If it's a 2 current, the time gonna be 20 minutes. If it's a 1 current, then the time gonna be 40 minutes. So we always wanna with the lowest the time with the highest the current. So we start with 4 current and then 40 milliamp per minute. So once everything's is ready, then we hit the start. Here, yeah, say please wait. The time is on.
Before the treatment, make sure you ask your patient if he ever had an allergic reaction to lidocaine, and if they feel comfortable, they shouldn't feel any uncomfortable sensation. And after the treatment, re-inspect the skin, and you can explain your patient that they can have a little bit of redness, but it should disappear within a few hours.
Hi everyone, today we're going to talk about how this laser machine can be done in clinical field. Laser machine can be done in so many ways, such as promote collagen production, promote vasodilation, promote the tissue healing, modulate the inflammation to treat the patient has ulceritis, lymphedema, neurological condition, and pain management. Moreover, the laser machine is only the modality in the physical therapy field which can apply on the bone directly. So let's get started.
Let's go more in depth into the laser machine here. So what we first want to do obviously is plug the machine in. So we have our bigger plug back here. Okay. There's also a key in the back of the machine, so we want to make sure we turn that. All right, just turned it off, just for turning's sake, but I'll turn it back on here. Okay, so now before we jump into what the menu reads here, I just want to point out some of the items for the machine. Here we have our laser gun. We have our 2 SLD pads here. We have our goggles, which are very important for the eyes, one for the patient, one for the clinician. And we have a menu down here. If need be, the clinician can go more in depth into various pathologies in case they forget how to treat it or what the parameters are. All right, so if we jump into the menu now, we're prompted to select either ports 1, 2, or 3. So if we, for example, select port 1, we're only going to administer this laser treatment with the laser gun over here. If we select port 2, we're going to administer a laser treatment as well as an SLD treatment with one of these pads here. If we select port 3, we're going to administer a laser treatment and SLD treatment with both of these pads here. Right? So now, the good thing about this machine is that if you get confused or if you forget how to sort of go about handling it, you can just read the menu. So let's just say we are treating a patient with port 1 right now. We press 1, and then a new prompt comes up here. So this prompt says that we can choose different settings. Either manually, we can set our parameters, or we can choose to have set parameters for various tissue. So we're gonna hit enter. Okay, here we have our manual setup. So let's say we're doing it manually, we enter our joules, with the keypad here. But if we wanted to choose set parameters for various tissue, okay, we would use the arrow keys here, and as we can see, we scroll down. 1 is muscle, 2 is for joints, 3 is for nerves, 4 is to promote circulation, 5 is for superficial closed, 6 is for superficial open, and then we're back to manual. So because we're great clinicians and we understand what amount of joules to use for various pathologies, we're going to check manual. So here, depending on what pathology we have, we can enter the number of joules that are required to treat that pathology. So for example, if we are treating an acute arthritic condition, our joules would be set between 2 and 4. So just for safety's sake, we start on the low end, we enter 2, and then we press enter. Now we're prompted to choose either continuous pulse or a pulse with interruptions in between. So what we want to do is we want to start with continuous, and if the patient feels discomfort, we can switch to pulsed. So we'll push 0 for continuous, and then we will press start. Okay, now just to keep in mind, we can press start and the menu says the treatment will start in a certain amount of time. However, we can only start the treatment if we click this laser gun trigger over here. Now, going back, we selected port 1, which is only a laser treatment, but if we were to, let's say, select port 2 or 3, we can still administer the laser treatment and the SLD treatment, or just the SLD treatment alone, as long as we press the trigger, choose to press the trigger or not. That will depend on what we're treating.
Let's jump into treatment using the laser machine. So I'm going to be treating Jason for rheumatoid arthritis in the right hand, and I'm turning on the machine. Now we're only going to be using laser, so I'm going to choose port 1, then press enter. For joules, I'm going to be using 3 joules just because it's the first treatment. I'm going to click enter. I'm going to be using a continuous instead of pulse. Now, before I press start, I'm going to give Jason these glasses to protect him from the laser. And I will also be using glasses to protect myself. Okay, so put these on. Okay, now I'm going to take off the cover, and as soon as you take off the cover, you want to put it right onto that treatment area. Okay, so I'm going to be doing the MCP joint, and I will press start, and once you press start, it counts down, and I'm going to press the trigger, and now the treatment has begun. The green light is on to let you know that it's giving the treatment. Okay, so the light is off. Now I could remove the laser, and I'm going to be placing it in the other joint. Okay, now I'm going to press the trigger, and the treatment will continue for this one. Okay, it's counting down. Now I should mention the time is automated depending on how many joules you use. So that's good. Alright, so you could continue moving along to each joint as long as you don't repeat the joint. repeat the area of treatment. Jason, you could remove your glasses. And we could shut off the machine. And we are done.
Hi, my name is Ingrid, and I'm going to be demonstrating placement of the laser. First, we're going to start with the cervical area. If the patient has herniated disc on the cervical spine, for example, he could have a herniated disc on C5, we'll place the laser on the vertebrae where the herniated disc is, and then after we would follow the path of the radicular pain, and we would move the laser along that area where the pain is radiating. This is the placement of the SLD for biceps tendon at the origin and the insertion of the biceps, and then you can place the laser in the area of pain, even up on the upper traps. Assuming that the shirt is not on. For rotator cuff issues, you can place an SLD on the shoulder, on the anterior deltoid, and then you can treat the area of pain with the laser. You could go on the supraspinatus. You could do it around the infraspinatus, and also on the traps, the upper traps, and just move it along that area of pain. Do it on the shoulder too. Or you can also place two SLDs. You can put one on the back. Shoulder. For frozen joint and impingement, you place the laser all around the joint, the shoulder joint, surround the supraspinatus, anterior, posterior, and you can also put one SLD here and another one posterior. For the treatment of lymphedema, we can place the SLD under the axilla, and we are going to treat the lymph nodes under the axilla with the laser, and we are going to follow the path of the lymph nodes along this area. Now I'm going to demonstrate placement of laser and SLD for treatment of carpal tunnel syndrome. So we would place the SLD on the thinner eminence. And just follow the median nerve. We could place another SLD here. On the forearm, on the wrist. And then following the path of the median nerve, we can place the laser at the level of C5 or T1. And we can even place the laser on the upper traps. For trochanteric bursitis, we will place the laser on the greater trochanter and then around the area of the greater trochanter. And at the same time, we could place the SLD on the tensor fasciae. Thank you. It's a very helpful patient. We'll plate another one. Place another one. And then the laser, the greater. To treat pain or osteoarthritis of the knee, we would surround the area, the knee area, with the laser to treat the painful. For other conditions such as patellar tendonitis, we can place 2 SLDs on the quadriceps. One higher in the quad. And one on the lower area in the quad. And then we can place the laser on the patellar tendon. And for meniscus issues, we are going to use also the laser surrounding the area of pain. Around the meniscus. Here. And the other side. If the patient has Achilles tendonitis, we will place the laser on the Achilles tendon, which is more in a deeper area, and then we will place the SLD on the gastro, which is more superficial, but it will target the pain on the gastro. We'll just wrap it like this. And then do the laser on the Achilles tendon, and then we'll move it around on each side of the tendon. We can also treat plantar fasciitis with the laser. We can place the SLD on the plantar side of the foot, more on the middle. And then with the laser, we can put the laser on the calcaneus in different areas.
Hello, this is Sunny, and I'd like to talk about you should remember before treatment. And so patients and therapists should wear goggles, not to expose your eye area to the laser, and you should ask 2 questions about patient has malignant tumor or they have radiation treatment within 4 to 6 months. Or they have hemorrhage, and you shouldn't place the laser on the thyroid gland, and no lower back or abdomen on pregnancy woman, and no epiphyseal plate into the children or impaired sensation area. And you should ask too about the medication like Benadryl, ibuprofen, Plexarin, Lasix, and you should ask the questions about patient has photophobia or something. And you should check before and after the wound area.